Pepito, and I'm with the Other Side Media, brand new YouTube channel. And I want to introduce everyone to Dr. Earl.
Hello,
What's
everyone.
your real name? What do we call you?
Well, I mentioned before, I'm not too formal, so you just snap your fingers and point over here, and I'll come running. Dr. Earl is fine. Brett is also fine. Like I said, I don't get too caught up on doing way too much medicine. So.
Perfect. Well, why I'm here, I've never met you before, and I'm here at your clinic. Why don't you tell me a little bit about this clinic? What do you do?
Yeah, it's been very exciting. So, and maybe just a little background into myself and why I started this clinic. I am board certified in emergency medicine. I practiced for 16 years. It was a great experience, but I ended up getting a fungal infection in my lungs, and my health went from being an avid weightlifter and runner, and I used to play baseball in college. I mean, I was into health and fitness. And within 9 months, I couldn't lift barely the bar and a little bit of weight off my chest.
That's crazy to me.
And I went to all kinds of doctors, heart doctor, everyone, infectious disease, and they had no answers. So I realized it was up to me to figure out what was going on. And fortunately, I initially got tuned into something called functional medicine. Now I practice something called foundational medicine, different story and different concept, but a lot of fun. But we really look at that root source of what's causing the disease and try to fix that. Well, in my process of learning what was going on with me, I uncovered this amazing, vast scientific reality of truth that is out there of how amazing the human body is if we just give it what it needs and get out of the way. Western medicine really has gotten to the point where they're trying to add everything to really compensate for what we're doing wrong. And there's a lot of reality in just looking and saying, let's take this away. Let's get that out of your life, out of your system, and watch the body heal. The body is a miracle, and we just need to pay attention, work with it, and move forward. So
now, you were trained in Western medicine, correct?
Yes.
So you were a bona fide ER doctor for 16 years.
I have an MD, and that stands for mentally deranged. Really true.
So when something happened to you, and you went to all the doctors and everything else, and they couldn't figure out what was wrong,
right,
something clicked in your brain to say, I need to find my own solution to my problem.
Right. And you know what? I'll attribute a lot of this to hard work, but also just some serious blessings and divine intervention, however you want to take that. Because the reality is, I was led to people and conferences and situations that made a difference in my overall health, and am very honored to be here in this situation. The reality is, I was on a rapid path towards death and had some very close calls along the path. But again, now super grateful that I'm here and I can make a big impact in the health and lives of others.
So what's the name of your clinic?
Denali Medical, and we can be found at denalimed.com.
Okay, and what do you specialize in?
So right now, a big issue with my fungal infection was the fact that the parasites, the fungal infections, a lot of these things that plague us, they release these enzymes that break down the cartilage and that makes up our joints. And so I had a lot of joint pain. So I was introduced to a provider who was doing a version of this. We're now 4 versions advanced from that, but he was doing a version of these injections, and it worked so well. I really went from having pain everywhere, and I kid you not, everywhere. My feet ached, plantar fasciitis, big toe was bone on bone, left ankle I had a sprain that wouldn't heal, my knees, my back, my tailbone, my neck, shoulder from playing baseball, elbow from baseball, wrist, and then I actually had arthritis so bad in my pinky it was starting to twist.
Oh my.
Yeah, and so we just started injecting, and I'm like, man, if this is good for me, I want to bring it to everyone. I want everyone to feel this good.
So not functional medicine, but foundational medicine now.
Mm-hmm. Which is, we rely a lot on foundational medicine. Mm-hmm. We just try to dig a little deeper.
Just kind of evolving from that.
Yes.
And learning.
Yeah.
Got it. All right, so you're talking about these injections. So what is it?
So we call it Renuo 2. It's a combination of anti-inflammatories, B vitamins, and then some neuro reset combined with empowered oxygen, and that's really the key. Empowered oxygen. In fact, the 2019 Nobel Prize for Medicine and Physiology, they revealed that oxygen activates 300 healing genes inside your DNA, and they actually said, we think we're just getting started. We think that 300 is low. We think it's much higher than that. And that's really what we do. We put that mix into your body, and it works anywhere that moves, anywhere in knees, ankles. I mentioned all the things that I had. Anywhere along your spine. I had neck pain, I had back pain, disc issues. I mean, the list just goes on and on. And if it moves, this helps your body repair it. And I want to make that distinction. What we're doing is giving your body the exact thing it needs to repair itself.
So not slapping a Band-Aid,
right,
with a pill,
correct,
or something.
And healing is a process. We tell patients, this is a process. You're here, you want to get here. It's going to take us some time, and we just keep building on the next injection and the next, and people get well. We put out there that we have an 87% success rate, but the reality is that's low. And I love under-promising and over-delivering. I love that. And so the reality is we get patients well. We have a contract with a business here that does their own insurance. And so they just keep sending their patients to us until they get well. And so far we've had 0 failures with them because they just keep coming back. It's beautiful. So the reality is, fix the problem, or give the body what it needs to fix the problem
Itself.
and stand back. And here's the other key that I forgot to mention. Sorry. But I ask patients, or I ask doctors who say, oh, that's impossible. I say, why? Where did the instruction manual go that put you together? Your DNA. It's still in there. It just needs to be turned on. That's all we do.
Yeah, see, and for a layman, I actually can understand what you're talking about. So it doesn't seem very complicated. To me, it's more like common sense. Fix something in your body, help it fix itself, and then you're better.
Right, and then we turn on that healing engine inside of you. I don't know about you, but when I was young, I jumped out of trees. I mean, I did crazy things. And my knee would hurt for a little bit, my back would be sore, and in 3 weeks, I was better. I was back doing exactly what I wanted. And it's not because I was taking the pills or doing certain, my healing engine was still turned on because I was so young.
And as we get older, it just takes a little whoop.
Yep.
A little push.
Yep.
To get that healing engine started.
That's right. Yep.
Got it. All right.
We ought to call it starter fluid for the healing engine. I
think that's good. I think it's good too. So I hear that you have a COVID clinic here as well. It's not on your website. Tell me about the COVID clinic. What I know is that you treat people that have had COVID, and if they got all jacked up from the after effects, and you help their body heal. So tell me a little bit about that.
Yeah, so let's look at some of those issues. So the first is it's not on the website, and there's a reason for that. Right now, COVID is a hot issue from a medical licensing standpoint, from all kinds of different things. And we have to just be very careful about what we say and what we don't say in regards to the COVID clinic. In fact, to start this, I actually interviewed and talked with multiple doctors and came up with these 7 things that I have to do to stay safe. And one of them is I have to be very, very careful how I market it and what I put out there and the things that I say.
And to stay safe, that means to not be censured and censored.
Censored, or even lose my license.
Got it. Yeah.
They're actually doctors who, they're in front of their licensing boards because they're doing those things. And that's not to say they can't and won't, but I'm just trying to do everything I can
just
to
stay, do your thing.
Yeah.
And be smart about it.
And the big issue too there with, people say that, oh, this is used off label. And so I need to notify people that, yes, some of the things we do, some are off label, but keep this in mind. 25% of medicine that we practice in Western medicine is off label. So
what does off label mean?
So off label means it hasn't been approved either by the medical boards and or the FDA. But again, that's 25% of medicine. So 1/4 of the things that we do in medicine is already off label. So one of the things to protect myself is I needed to include all the research and the data and the information as to why doing this off label is safe, effective, and will benefit the patient.
And it's science-based, correct?
Correct.
Okay. So there you go.
And the issue is, with all of these protocols that I have, there's a 50 line thing of research, listing of research that shows all of the pertinent research, because the reality is I've looked at hundreds of articles in order to, and really just selected the 50 that make the biggest difference.
So what are the main things that you're seeing in your COVID clinic? Who are the main patients? Like, what are you seeing the most right now?
So we do a lot with the with medical exemptions. We try to make sure that it matches. Here's the issue with medical exemptions is I can't fabricate something. I can't make it up, something. It has to match. There's right now, and the reason why I can't broadcast these 4 things, there's 4 to 5 things that the CDC and in employers have to recognize as being a problem. But I really can't put that out there. Once again, why is it not on the website? Because if I do and they change it, now they have means or reasons to go after me. So anyway, long story short, we do some medical exemptions. The big thing right now is we pre-treat the symptoms of the vaccine. A perfect example, we were setting up for this interview.
Yeah.
And I get called upstairs to help with a patient who's receiving one of our IVs. He's had COVID he got COVID a year ago. He and his wife have just felt miserable. So he's been on our protocol and he said, gosh, your protocols have really just turned me around and made it so I can function. I feel alive again, which is great. So we treat post-COVID syndrome issues, but he just received the vaccine 7 days ago. And now he's having this episode of neuritis, so nerve inflammation. And they've shown that throughout the research that there's this neuritis. And so the idea is to pre-treat those symptoms, meaning treat them before you get the vaccine. Then when you get the vaccine, the symptoms are minimized or eliminated.
So you are basically boosting the immune system?
It's a combination of things that we're doing. Yes, we boost the immune system. We try and help it so that the symptoms such as blood clotting, the neuritis, some of those other issues are non-issues. And we've actually done blood tests on patients before and after receiving our pre-treatment. And those risks of blood clotting and so forth are actually lower, which is pretty exciting.
That's really cool. So are you allowed to say what the treatment is or no?
Yeah, well, I can, but it's a combination of things.
Is it based on the individual, basically?
So what happens is I have a protocol and then we adjust it to the individual if they need any adjustments.
They need it.
But the idea is we use science that has been shown to minimize the effects of the everything from the mRNA, the clotting. We boost the immune system. We actually have something you do right when they do the shot. We actually do have a piece of the treatment that actually seals your blood-brain barrier. One of the big issues with the vaccine is some of it is getting into the brain. And so we actually seal that an hour before.
In an autopsy.
Yeah.
And it's usually hits the elderly. Mm-hmm. And they opened up their brain and there was a gigantic blood clot in there. It was freaked me out. So is this the brain barrier that you're talking about?
So that coincides with that. But yes, we're finding the vaccine will actually get into the brain and cause issues there. So if we can seal that blood-brain barrier, we prevent those big issues from happening.
Now, a question for you. Who would you recommend the vaccine to and not? Do you have or do you not recommend the vaccine? Like, what's your...
Boy, that is a political and licensing disaster.
Political, yes, definitely. Yeah. So it's more of a political vaccine versus a real vaccine. I don't know. Yeah.
Here's some interesting facts, and
perfect.
And I'll just draw out some interesting facts. In order for this vaccine to be labeled as a vaccine, Webster's dictionary actually had to change their definition of vaccines.
Did they just change it?
Yes, within a
year.
Way,
really?
Yes.
Did not know that.
So Webster's just changed their definition of vaccines. They again, there's just all of these different components that say it's a little interesting. We're seeing a ton of side effects, both from the vaccine and from COVID. Again, right now coming out with a hard statement as far as who to recommend it and who not to recommend it.
Just boop.
You have to be very careful for one, but the other issue is I look at this based on reality. There are patients that people that still have to go to work. There are people that still have to provide for their families. There are people that still need to travel. And so instead of looking at
should you or shouldn't
should you or shouldn't I,
I'm going to
help you
yes.
with the problem.
I like that better.
Which is the symptoms.
I like that better.
And so we do the pre-vaccine, we help boost the immune system, and that's a different protocol. We have 12 different protocols that we can use for a variety of different conditions.
And you can adjust it based on the individual.
Okay,
so you're basically there just to help regardless of anyone's personal choice.
Correct.
That's great, I think.
Yeah.
So how do people get in contact with you?
The easiest way, so certainly denalimed.com, but you'll see the various things that we do. So we talked about the injections. We have an amazing breast health program that really reduces your risk of inflammation, cancer, and so forth significantly, 50 to 70%. We have migraine therapy that's absolutely amazing.
I saw that on the website.
I know, it's really cool. And then we have our IV therapy. Our IV therapy is second to none. We put in between 3 and 5 times more components into our IVs than anyone else. And they're balanced in such a way. We have patients that will come here and say, oh, I'm not sure, there's a place that's closer. They go someplace closer, they're back, because it just makes a big difference to have everything perfectly balanced. And then, but as far as answering your question, the easiest way is to call our phone number. It's 801-389-4697. And you can ask them your questions about the COVID vaccine and then get on the schedule.
That's perfect. And also, I had one more question about costs, because I saw on your website that all in all, between Western medicine, insurance, and co-payments versus your treatments, the cost of your treatments ends up being cheaper than co-payments and insurance and everything else. Because a lot of times, like what you said, people try all these different Western medicine, like pills and this and that, and then they end up getting surgery, when in fact you could do this protocol and basically have the body heal itself from within instead of slapping a Band-Aid on everything.
Right. And that brings up such a good point, because you end up spending less than you'd pay on your copay, number one. We don't have any limitations. You go right back to work. You go right back to your activities.
There's no side effects.
You don't lose work. Well, we're using things that naturally trigger the body to heal. So no. So you don't lose work. Big money savings there. Or you don't lose the money you would have earned. And then the other thing is, if you get injection or get surgery, they're hoping to get 10 years out of that surgery. There are places I've injected on my body, my neck, for example. It's been 15 years now, and
you're an athlete,
and I haven't lived a perfect life.
Right.
I still go out and beat my body up, and I run a farm, and I'm doing these crazy things, and I'll go home and I'm like, oh, within a day, usually within a day, but most 2. My body's pieced it all back together, and away I go. That's 15 years of awesomeness. So I'm not back getting surgery. I'm not taking pills. I'm not doing prescriptions. I'm not meeting a yearly stipend or a yearly an annual amount that has to be hit before something kicks in. My body just takes care of itself. And I wanted to speaking of taking care of yourself, mention one other thing about the COVID clinic. One of our protocols that we actually have, we have a travel protocol. We have a protocol that if you're worried about getting exposed, and we know that there's certain medications that can help if you're worried about getting exposed, and having those medications ready to go, because by the time you make an appointment with your doctor and then get in and etc., you're so past the window. We actually have a protocol that we will give you the prescriptions, the protocol, everything you need, and you put it on the shelf. So day one, when you get sick and you're sure it's COVID, and that I would recommend you make sure it's COVID, but day one, you start those medications.
So you can actually prescribe those medications beforehand.
Correct.
That's cool.
Yep.
Yeah.
Yep.
So that's cool, the COVID clinic. So is there anything else that you would like to tell me about COVID clinic, or anything else about your business?
I would just say this, it's a lot of fun. The reality is I got into medicine to help people. And as we talked about COVID clinic before, but I'm very blessed, lucky, however you want to look at it, to have been able to experience this medicine myself
For yourself.
and now be able to offer it to everyone else. That's really what it's all about. That's what makes this enjoyable. It's what makes it fun. Being able to solve the impossible problem. Right now, the impossible problem is COVID, but forever and for a lot of people, it's still the joint pain, the knee pain, the shoulder pain, the back pain, all of those pains and discomforts. For a lot of women, it's, keeping their breasts healthy. How do they do that and still keep them alive and looking the way they should? Well, there's a natural process to do that we just teach you and you do at home. I mean, just amazing what the body will do is if we give it what it wants and needs and get out of the way.
That's amazing. Thank you for your time.
Thank you.
Dr. Earl. All right.